Hello and welcome to our first virtual meeting of SOS Berks, your local opioids coalition. I am County Commissioner Kevin Barnhardt, co-chairing this effort with our Director of the Council on Chemical Abuse, Stanley Papademetriou. We have been meeting aggressively over the last 4+ years on a monthly basis when locally we saw a large spike in opioids, overdoses, and ultimately deaths from opioids. So we pulled our group together of almost 75 people in the community, from healthcare on down the line through law enforcement, medical professionals, our warden at the jail, to really pull together this community to save lives. So our goal is to save lives. And we're here today because we're all struggling through COVID-19, this pandemic that has sucked the life out of our community over the last 2 months. And we know as a coalition that people are still suffering from those same substance use disorders they've had. We want you to know that we're here, we're able to reach out to you in any way, shape, or form we can help you. Many of these situations like substance use disorder have not gone away. They're probably more difficult now that you don't have a lot of social, if any, social interaction, engagement with family members and friends. These are desperate times for everyone. And we just want you to simply know that we are here to support you and to help. And in any way possible, COCA has been open, doing the best they can under these trying circumstances with Narcan distribution, with meeting with folks virtually if that's possible, just to keep everyone's spirits going and keeping this community vibrant as it always has been, because we are going to get through this together. We all stay safe, we do our part, and we'll be back to our very productive, healthy lives. But again, I want to reemphasize the fact we're here for you, we care about you, folks in the substance use disorders, whatever they may be, because most recently in the last year, SOS Berks Opioids Coalition has kind of switched focus a little bit. We're still very concerned about the opioids crisis, but any substance use disorder whatsoever is vitally important to us to help you to get the treatment you need and the recovery you're hoping for. So with that, I would like to turn this over to my co-chair, Stan Papademetriou, and he can take it from here. Thank you and God bless you.
As Commissioner Barnhardt said, this is going to be an update with regard to things that are happening with SOS Berks. The group has been around since 2016, made up of various stakeholders in the community, whether it be healthcare, law enforcement, social services, private citizens, come together monthly to discuss strategies on ways to address the opioid and overdose crisis that we're having here in Berks. I would imagine by now everyone would have known that there's been a problem in Berks County for several years. There was a significant jump in overdose deaths between 2015 and 2016. And then steadily from there, we've maintained about 2 deaths per week, at least 2 deaths per week from an overdose in Berks County. And that's a significant number if we think about that, because 2 deaths, people that we know, love, neighbors, friends, loved ones, whatever. So this group has come together to find ways to address this. A strategic plan has been developed several years ago. We're trying to adhere to that plan. We have a committee structure that looks at various aspects, whether it be, prevention education in the community, how to better access people into care, how to make our community even safer. And it's been a real collaborative effort. One of the best things that I think that has come out of this is the collaboration between different entities and different disciplines, if you will, in terms of how to address this issue. Some of the things that we've been working on are like drug take-back events, medication disposal. We have a warm handoff program here in Berks County that is a model for not just the state but the region in terms of getting folks from emergency rooms into treatment. We have a stigma reduction program. We have a very robust Narcan distribution, both to first responders as well as to community members getting Narcan in their hand. And for those of you that aren't aware of what Narcan is, it's the antidote for an opioid overdose, and it saves lives, and it saves lives all the time. We also are very proud of a periodical that we have put out twice a year called The Response. It's a collaborative effort addressing many different aspects of overdoses and opioid use and substance use disorders in general. And we get this out to the community. We distribute anywhere between 15 to 18,000 of these in the community. We will continue to produce this magazine as long as we can. We have a stigma reduction project that we're working on now. And for those of us that work with this, and maybe even those of you that don't work with this, realize that stigma is one of the contributors to keeping people in an active addiction, and leads to many folks ending up dying or ending up in jail or ending up in some kind of institution, and all the negative things that addiction brings to somebody. One of the things that we're proud of probably most that really was a genesis out of this group was our Blue Cares program, which was a collaborative effort between substance use treatment and law enforcement, where when the law enforcement is involved in the save of someone who overdosed, that a police officer and a certified recovery specialist will actually make a visit to the survivor's home and talk to them, not about what kind of trouble they may be in, but the concern that the person could have died, and trying to get them into treatment, as well as offering the family whatever kind of support that might be available. Today's event that we're having with you all today is really just a snapshot in terms of what's going on now. And we asked three very distinguished people to join us. District Attorney John Adams will speak to us a little bit about, from a law enforcement perspective, what's happening out there now. We have Dr. William Santoro, who's going to talk about the treatment of addiction, and especially as it relates to medication-assisted treatment. And then we have Yvonne Stroman, who's a program representative at the Council on Chemical Abuse, who will talk a bit about recovery and some of the challenges happening right now. We had wanted this to be a live event so we could handle questions and comments as we went. We apologize, but on our end, we just weren't able to make that happen this time. Next time we do something like this, we're hoping that that would occur, but please feel free to leave any questions that you have in the comments box. We will respond to every question. We'll respond as quickly as possible. It might take us, we might have to come back to one of our individuals here and get an answer for them. But please, if you have any questions or comments, please leave them for us. So the first person that we're going to ask to speak is our illustrious District Attorney, John Adams, and can't say enough about what he's done with regard to this issue. Way back in 2015, he pretty much coined the phrase, "We're not going to arrest our way out of this problem." He recognized the fact that criminal behavior needs to be addressed. People need to be arrested and prosecuted, but he also recognized the fact that many people who are being caught up in this issue have an addiction disorder, have a brain disease, if you will, and that rehabilitation of that is vital and crucial. He's been a great partner in this SOS Berks collaboration, and he's actually, through some of the drug forfeiture monies that he was able to collect, has helped Berks County open its first community recovery center. And we're very proud that John is part of our group. And I'm going to turn it over to District Attorney Adams now for his thoughts.
Thank you, Stan. And I really want to thank everyone that's a member of this committee. This is an important committee, and we are all doing very important work to combat this problem in Berks County. We are working together and working as a team. This is not, as Stan said, that I coined a phrase years ago, we are not going to arrest our way out of the problem. We need to help people, and they need to help themselves also. But this collaborative effort that we have is a very important step to doing that, and to helping people, and to helping this problem that exists in our community. One of the first items that I wanted to address, there has been some reports throughout the nation and throughout other counties in Pennsylvania that the number of overdoses has increased. I'm proud to report that in Berks County, we have not seen an increase in the overdose deaths. We still, though, have way too many people who have passed from the use of drugs. And we are seeing well over 70% of those who pass as a result of their use of drugs and die from overdoses, they are utilizing a substance that has within it fentanyl. And I have called fentanyl the denominator of death. We are seeing fentanyl in heroin, we are seeing fentanyl pure, and we are seeing fentanyl in cocaine and in methamphetamine. So almost every street drug that is out there has the ability to be laced with fentanyl. It, I think, gives a bigger high, but it kills. And we've got to be aware of that. And we need to know that those who are addicted to drugs, they've got to be very careful, seek treatment. In I want to touch briefly on some of the statistics that I've put together, and from this year and the past years. This year in 2020, as of May 6th, the last date that I have the updated statistics, we are right on par. Actually, the number is almost exactly the same for the number of overdose deaths that we've had to this date in comparison with 2019. We've had already 41 overdose deaths this year. Now we are waiting on toxicology results on a number of those, on 11 of those deaths. But I am, for purposes of this report, I am reporting that we have 41, although we are waiting 11 toxicology tests on that 41 number. In 2019, as of May 6th, we had 40 overdose deaths. So we're right on par. But again, in 2018, as of this date, we had 32 deaths. 2018, we had 100 overdose deaths. 2019, we had a total of 127 deaths. Too many deaths. Just to put that in perspective, in 2017, we had 120 overdose deaths. 2016, 123 overdose deaths. 2015, 73 deaths. In 2014, 65 deaths. So we have seen an increase in the past 6 years, quite an increase. And I have said numerous times, and I will repeat it again, the reason that we are seeing this increase is the fact that many of our street drugs are now laced with fentanyl. And fentanyl is very potent and causes deaths, and it causes death sometimes immediately. You know, one of the other things that we all are aware of as we are participating in these Zoom meetings, we're doing court virtually, we're doing everything virtually through the computer. We're not having that personal contact that we were once have all the time. And I know it makes it more difficult, but it's a fact of life right now as we face this crisis. We have seen a little bit of a drop in crime during this pandemic. However, we've seen an extreme drop in the number of DUI arrests. I expect those numbers will go up. I also expect that we will see an increase in crime in the near future as we move out of the red stage of this fight. And I expect that we are unfortunately going to be impacted by the by the fact that we were utilizing skeletal staffs in the district attorney's office, and that law enforcement themselves have not been enforcing to the point that they were previously. But that's about to change. And I expect enforcement to increase and the number of criminal cases to increase. I also wanted to touch upon what we are seeing in our county and also somewhat globally in regard to drugs, the supply, and the demand. Clearly, we believe that the supply is pretty much the same. We've seen some from some work that we do daily. We have seen periods of time where there may have been a lack of supply, but we think that was just an anomaly, and we are seeing a steady supply of drugs available on the streets. Nationally, we've seen a little bit of a decline in some drugs, but we are seeing, in essence, our markets are pretty much the same. Demand has stayed pretty much the same. And unfortunately, when we have that steady demand, we're going to see people lose their life. We need people to get into treatment if at all possible. We are still seeing overdose deaths. We have investigated a number of overdose deaths recently, so they are continuing, and we're continuing to battle those deaths and the selling and the proliferation of drugs on our street. So we're going to make sure that we do our part to stop the flow as best possible. But as I've said many times, and we've heard it earlier in this show, we aren't going to arrest our way out of this problem. This problem and the results of this problem can only be won if we work collaboratively, not only maybe arresting the dealers, but we've got to get those people who need the help into addiction. So I can't say enough. If you need help, please call the Council on Chemical Abuse and get the help you need. Thank you.
Thanks so much, District Attorney Adams, and we appreciate that update, knowing full well that while April saw a dip in the number of overdose deaths, thankfully, in Berks County, that we are really on par with 2019, which was our watershed year in terms of the most overdose deaths that we had here in the county. And thank you and all of law enforcement and the criminal justice system for all their efforts, because we also know full well that there's a lot of folks who have an addiction disorder get the help they need as they enter the criminal justice system, because most people don't seek treatment on their own. Sometimes they need to be coerced, and the criminal justice system has done that many times over the years. Next, I'm going to be introducing Dr. William Santoro, who is American Society of Addiction Medicine physician, and we're truly lucky here in Berks County because he is an addiction expert. He's been in this field, in the addiction field, for a very, very long time, aside from his practices that he had over the years. But he's been treating addiction a long time and had been treating addiction through medications, effective medications, be it initially with methadone and then Suboxone as well as others. He's in the cutting edge of a lot of these medication-assisted therapies, as they call them. And he truly understands the need for some people to use medication to help them address their addiction disorder. And he fully quite understands that in many instances, an abstinence-only model is the correct way to go. So really pleased that he's in Berks County. Super excited that he's on our SOS Berks coalition, and happy that he agreed to participate with us today. So I'd like to introduce Dr. William Santoro.
Thank you, Stan. First, I'm going to apologize. I have some asthma, and my asthma has been kicking up. My symptoms of asthma is coughing. So Jen will have to cut out my cough when necessary. So when this program was first introduced, I was asked to think about how the treatment of addiction has been affected by the pandemic. And I got to thinking there are really 4 areas that we treat patients in addiction. If I can divide up my patients into these different categories, I would say that we have inpatient drug and alcohol treatment facilities. We've got outpatient office clinic programs. We have inpatient hospital consulting services and outpatient methadone treatment programs. So I'm going to go through it a little bit at a time, each one a little at a time. You know, when the pandemic started, I was concerned that the patients with a substance use disorder were at a higher risk for contracting COVID-19 and the complications associated with it. Because regardless of the age of the patient, these patients have a higher risk of being homeless, as well as having other risk factors that would prevent them from getting treatment and barriers to care. You know, it's difficult to shelter in place when you're living in a shelter. It's even more difficult to shelter in place when you're living on the streets. And while there are less people on the streets, could mean that there are less people buying and selling drugs. The reality is that social distancing is the least of the priorities of somebody who's dealing in illicit drugs. Nobody is selling drugs and dropping off the drugs 6 feet away saying to their customer, drop your money and then we'll switch at a safe distance. So with that as a backdrop, let's start with how have things changed with the inpatient drug and alcohol treatment facilities in their management of this disease. Well, one of the earlier concerns was that we thought there would be a substantial increase in the number of patients looking for admission to a drug and alcohol treatment program, specifically for alcohol use disorder. The concern was based on the fact that the bars were closed, the state stores were closed, and with a decrease in the availability of alcohol, we suspected that there would be more patients going into alcohol withdrawal. The other problem that we thought of early on was that patients immediately would not be able to continue to go to their 12-step meetings. And for a lot of people, 12-step meetings are the backbone of their treatment program. But they need to be canceled. And one of the things about 12-step meetings is the close-knit population of those people. They get together and that is their goal, is to be together to support each other, which goes beyond just handshakes, but includes oftentimes hugging a person next to you, holding hands, any other type of physical support. This needed to stop because of the social distancing, obviously. Once patients were admitted to the drug and alcohol treatment facilities, the facilities themselves also had to change. We often talk about the therapeutic community within a drug and alcohol treatment program. And the facilities immediately had to change where the model where each person could have a single room when possible. Again, for a lot of facilities, the idea of having a roommate was actually part of the treatment. You didn't want them alone. Well, now we're saying, well, we need to give that up and have the person, when possible, in a room by themselves. Group meetings within the facility were immediately limited in size depending on the room that they could use, so that we could keep patients socially distant by at least 6 feet. We also are having patients wearing masks in the treatment facility, and they're being taught some different hygiene. We're telling patients to wash their hands more often, to keep their distance and clean their area. You know, doing all these things still is not going to guarantee that, that patients will not get COVID-19 while in a treatment facility. But like in many things of medicine, we had to weigh the risks and the benefits. And we felt that the the risk of spreading COVID-19 within a facility was smaller than the benefit of a patient being there and getting treatment. Now, outpatient office programs have some different hurdles to get over. Patients in an outpatient program, oftentimes, if they needed and they can be seen, we said they would be seen. But if they were stable, we would screen them on the telephone, and if they're stable, we could do a telehealth telephone call or video conference call with the patient. So the first things that we did was we had our staff screen the patient on the phone and see if they're appropriate to come in. If they were appropriate to come in and not have a telehealth visit, we would ask questions such as, are you having any coughing, fevers? And if they pass through the screening, that means they would come into the office. Now, we would set up the schedule so that patients were not sitting in the waiting room for a long period of time with other patients. So we moved the seating to 6 to 10 feet apart from themselves within the waiting room. Once they got into seeing the physician, they would be seated 6 to 10 feet away from the physician. And both the physician and the patient were wearing masks. And the schedule was set up so that there was not a lot of patients coming and going. All doors that could be left open were left open. So we tried to make it that the patient could come in, walk in, go through the waiting room, get their screening process, see the front desk, and get into the doctor with touching as minimal things as possible. After the visit, we have the staff wipe down any area where that patient was, and then the process begins with the next patients. Physicians for a long time have been requesting the ability to use telehealth medicine for patients who were stable. In the past, we found that there were 3 barriers that existed to this: access, security, and by security I'm talking about HIPAA compliant, and reimbursement. But with the popularity of smartphones today, the access became not a barrier. The security, well, the government appropriately has lightened security on HIPAA during this pandemic, but most of us are thinking that's not going to last. So we wanted to create something that could last beyond the pandemic, because telehealth is something worthwhile to continue to do. So with the different platforms that are available, they are HIPAA compliant. And reimbursement, well, that's always been a problem and probably always will be a problem. But it is a battle we will continue to fight. So the next group of patients are patients that are involved in outpatient methadone treatment programs. Well, an outpatient methadone treatment program can do a lot of the things that the outpatient non-medical or non-methadone programs needed to do, except they had, again, certain barriers that were different than all the others. Namely, patient coming into a methadone program generally is going to need to be seen every day to get their medication until they're well enough to earn a takeout. Well, the takeouts are normally earned on a schedule. That schedule for many of these programs have been loosened. Now, we've got to be careful. We can't loosen it so much that we're giving takeouts to people who aren't stable, because we're going to increase the risk of that person either diverting their medication, relapsing, overdosing, and dying. So we have to be careful. Just because we have a more lax policy does not mean that every patient becomes eligible for the maximum number of takeouts. But the rest of the precautions are very similar to the outpatient non-methadone programs, in that we can screen them, they can come in, as many doors as possible can be left open along the way, and minimize patients' contact with other patients as well as with the providers. Now, methadone treatment program also has mandatory counseling. That counseling, again, has been moved in many cases to a telehealth video conference when the patient is stable. And the amount of counseling is proportioned to what the patient needs. So the rules have been, again, relaxed in the number of hours of counseling that a patient may need. However, a good program is going to look at and say, but what does the patient truly need? If we cut back on the counseling simply because we can, and we're increasing the patient's risk of relapse, that's not doing anybody any benefits. Okay, the final piece of the puzzle of addiction treatment is the inpatient hospital consulting service. Every hospital across the country has patients admitted to the hospital for one reason, only to find out that there's a secondary medical problem. Oftentimes that secondary medical problem is a substance use disorder. Sometimes it's known in advance because the patient is on medication already. Sometimes it's not, and it's found out because a suspicion and a person does a urine drug screen. Once the substance use disorder is identified or known, the needs need to be addressed. And in this case, a telehealth visit by an addictionist could be done as well. As an addictionist, we generally are not physically examining the patients as often as we would when, say, I was a family physician. So I can rely as an addictionist on the physical examination of the previous physician from the rest of the team, say the hospitalist or the surgeon. And by doing that, I'm actually decreasing the risk of the patient being exposed to me, and I'm decreasing the risk of myself or the other addictionists from getting exposed to a patient who may be shedding the virus. Now, I realize that a lot of the solutions that I've come up with center around telehealth and televisits. I think that we need to realize that COVID-19 has pushed a lot of the authorities into figuring out the problems with telehealth, but telehealth will never replace an in-office, face-to-face visit with a patient. One of the problems is that this disease oftentimes has a basis of a person-to-person or an interpersonal problem. And that's where the disease started and expands from. The treatment needs to also remain personal and interpersonal, whether we're talking about 12-step meetings or with a physician or with a counselor. This is going to need to be person to person. So I don't want everybody to think that we can replace all of what we're doing with telehealth. It can't replace the personal benefits that come with the treatment of this disease, but it can supplement to it. Those are the four areas that I wanted to cover with the treatment changes due to COVID-19. And with that, I'm going to turn it back over to Stan. Thank you.
Thank you, Dr. Santoro, for that. And it was very enlightening. And telehealth is a term that we didn't use a whole lot, at least in the substance use field. But as soon as the pandemic really started to take hold in mid-March, and we realized that people really needed care, the federal government, the state government really stepped up with regard to relaxing certain regulations to allow for telehealth. Now, this helped with regard to our access of people going into treatment. There's still people that are able to go get an assessment via telehealth and access care. And as you speak about ambulatory or outpatient care, people are still able to get those services. And even as you speak about medication-assisted treatment and allowing for greater availability of take-homes and those kind of things, that really helped kind of plug that up. When you get to things like residential care, where someone is going to live at the facility 24 hours a day, 7 days a week, you can't do that by telehealth. And what I am asked sometimes is, how's the drug and alcohol system, at least from a Berks County perspective, working? And my response, it is working. It's not working the way it had been working in February and early March or back in January, but it's working. People are getting into treatment. People are getting their outpatient counseling appointments. People are able to go to rehabs. None of our continuum has shut down. I mean, we still get people into rehab facilities, into withdrawal management or detox facilities, into halfway houses, into recovery houses. We're still able to do all those things, and we're quite happy about that. And it's good for the individual with the addiction disorder. Now, as you had mentioned, Dr. Santoro, it's an opportunity to study this also, because it's not the wave of the future for everyone to get their help this way. But it does open some possibilities for being able to get people into services or getting them to access services if there's challenges. Like, for instance, if they live in a rural community somewhere, or they can't get to an appointment during certain times, that they might be able to do some things via telehealth. And that's going to expand some opportunities. So during this time, as negative as this pandemic has been, this component of it has really given us an opportunity to view this, see this, and see where the field of addressing addiction disorder is going to take us over the next several years. One of the things you also hit upon, and I'm going to ask Yvonne Stroman to talk about, is a little bit about that face-to-face and about the recovery aspect. Because if you look at addressing substance use disorders, it is not an event, it is a continuum. And it's not like if someone broke their arm and they go to the hospital and they get their arm set and a cast put on, that's it. Recovery component of this is as important as the acute treatment component of this. And I've often said that not that treatment's easy, but the real hard part about this is the recovery part, living in a new way of life, if you will, in recovery from one that you were used to, and all the challenges that brings. And we've been blessed in Berks County to have a very strong and vibrant recovery community. There's many different pathways to recovery. It's not just 12-step meetings, but there are other recovery supports in the community. But they've been hampered during this pandemic because of just what you said, Dr. Santoro, that they can't get together in person, look in each other's eyes, or have that close personal contact and be able to address mutually their recovery issues and problems. And almost immediately, virtual meetings cropped up, meetings on the internet or on the web cropped up, and those are good and fine and well, and really are helpful. And they're especially helpful for those folks who have a little bit of more grounded recovery. But part of the issue is, are those folks who are new to recovery, this way of getting their support is a little bit more challenging. I've asked Yvonne Stroman, who's also part of SOS Berks, and luckily for us at the Council on Chemical Abuse, she works here as a program representative. And she's worked in various aspects of the drug and alcohol field. She understands drug and alcohol treatment, and she understands drug and alcohol addiction recovery. So we're asking Yvonne to share with everyone a little bit about the challenges that are being brought about regarding recovery through the pandemic. So Yvonne, if you would, please.
Well, thank you, Stan. And just to echo the sentiments of everyone, to know that the substance use disorder, the addiction that continues to permeate in our communities, is still in existence. Just because we are social distancing doesn't necessarily mean that folks have decided to take a break, that the disease of addiction still runs rampant in our communities. And we know that treatment is effective, as Dr. Santoro had mentioned about the various mediums of treatment, but we also know that the hard work, as Stan had mentioned, about the recovery aspect of it continues on a day-to-day basis. And so really want to just kind of talk about that in terms of what's available in our community as it relates to recovery. But more importantly, I want to set the tone about recovery and the essence of what that means for individuals. And so, you know, the nature of the disease of addiction is one of isolation to begin with. And so individuals are now facing that isolation. And then sometimes what brings about is that level of loneliness along with anxiety. And so if they don't have the realm of coping skills, if they don't have the initial aspect of recovery and what that means in terms of the 12-step help that's available, or some semblance of a mutual aid support, then they're more likely to return to what they know is to be normal for them, and that's to pick up a drink or a drug. But we really want to talk about also about the medium of recovery and the aspects that are associated with recovery in terms of now, due to social distancing, we don't have the wherewithal to go to 12-step help or mutual aid meetings. We can't necessarily meet person to person with our support group or our sponsor in that medium. But what we do know is that almost immediately when the order came from the state and our county for social distancing, immediately what went into action was what we call the chat rooms, the emergence of chat rooms, the emergence of Zoom meetings, the emergence of people really connecting through those media platforms that are really, really important to us today. And so today you can go onto Zoom and you can find hundreds of meetings that are evolving each week. And many, many more are cropping up even as we have this conversation this afternoon. Now, some people might not feel very comfortable with those Zoom meetings because they can't look at somebody, they can't touch somebody, as Dr. Santoro mentioned. Hugs are very, very important. Holding hands are very, very important. But we know that they are helping individuals be able to connect, begin to have those spaces, those safe spaces where they can go and really talk about what it means to maintain recovery one day at a time. So those genres or those mantras that we usually say about keeping it simple, the impetus and the importance of keeping it simple, keeping it one day at a time just for today, and the importance of connecting with somebody via a telephone or just to, you know, have that Zoom call is being very, very effective for many, many folks. We also encourage folks to try and find a sponsor, somebody that they can feel comfortable talking with about their feelings about wanting to use, or their feelings of what can they do in the midst of COVID-19 since social distancing is in place. And I'm going to talk in a few minutes about what are some of those helpful tips that can be very, very meaningful for individuals, whether they are 1 day sober, whether they are 10 months sober, whether they are 30 years sober. These things are really, really critical, and they work. They make a difference in individuals' lives. They help them stay connected. They help them stay grounded. And more importantly, they revitalize their lives to live well. We also know that in the chat rooms, now the chat rooms are something that are also in existence now due to the COVID-19 and the social distancing, but they allow individuals to, at the very minimum, be able to, it's kind of like, you know, when you're text messaging, those chat rooms, they begin to have those, plant those seeds about what are you doing to stay sober? What are you doing, you know, to immerse in your recovery and to one day at a time refrain from using alcohol and other drugs. And I also need to point out that not only substances can be habit forming, but also different behaviors, what we call process addictions. So if someone has a gambling disorder, or somebody may have, you know, a propensity for theft, you know, and so shopping can be something of a obsession for somebody. Those things can manifest themselves when, you know, someone is not using drugs and alcohol. And so we want individuals, we want family to really kind of stay connected with that individual, with that loved one, to make sure that they are connecting with, if they're currently involved in intensive or outpatient treatment, that they're really connecting with their counselor. Maybe there is a group that they are involved in terms of group counseling, that they're really connecting with their support group, that they're doing those things which can be very, very helpful in terms of the maintenance of their recovery. Those are things that we call slippery slopes, when you're not engaging in a healthy manner in those practices to stay in sobriety, and what we like to also call wellbriety. What are those nuances that you are capturing so that you are maintaining your recovery one day at a time? So I just kind of want to give some additional cues for folks that are in recovery in terms of what they can do to stay connected, because it's very, very important that while we might not be able to physically stay connected in a face-to-face, there are still some things that can be done from a perspective of just maintaining our recovery one day at a time. The first one I want to say is I think it's important that folks understand their own wellness and to take care of themselves. Take care of yourselves physically, physical exercise, daily walks. If you're a biker or you're a runner, those things you can still do. You can still do them in a safe way, in a healthy way, but make sure that you take care of yourself physically. Make sure that you still get plenty of rest. And by that, I mean, oftentimes, I think folks have kind of laxed their schedule a little bit because of social distancing. Maybe they don't have to get up and go to work the next morning, but I like to use the mantra, act as if. Act as if you're getting ready to go to work tomorrow. And so you want to get proper rest. You want to go to bed at a decent hour. You want to make sure that you take care of those personal things that you need to do. And so keeping that regular regimented routine really can help encourage that foundation of recovery. Maintain a busy schedule. Make sure that you are operating on a schedule whereby you are, engaging with your family on a regular basis. Now is a time that isolation is not your friend. And so you want to maintain from a virtual perspective or even a physical perspective that you can really stay engaged with your family and friends through phone calls, through text messages, and let folks know where you're at. If you're not in a really good space, maybe you're feeling a little bit more depressed than before about where things are at. There's some things that are unknowns to you in terms of when you'll go back to work or when you'll resume the regular schedule of counseling. Talk with people about that. Let folks know where you're at in terms of how you're thinking and how you're feeling, and really engage in those ideas about being positive and forward thinking. Make sure that you're keeping it simple. Do not get overwhelmed. Oftentimes we think about things that don't even 9 times out of 10 don't even come true, but we kind of impose things on ourselves that maintaining, a lot of stuff in our head, get out of your head and, make sure that you're maintaining a sense of keeping it simple. And what we also know from our own personal experiences that when we help others, when we reach out and help others, maybe mowing a neighbor's lawn when it's safe to do so, or maybe going out and just kind of, in our neighborhood, picking up trash randomly when it's safe to do so, keeping ourselves busy and helping others, extending that help to others. Perhaps you're living next to an older neighbor that can't do their own shopping, and make that volunteer that if you're going out for a few staples on your own, that you go and help a neighbor. But you'll find that there's a sense of purpose. When we have that sense of purpose for our daily living, then we're likely to have a more positive outlook and perspective on where we're at. I also want to say families, you are a very strong role and vital piece of the puzzle to this. To check in on your loved one, to ask them how are they doing, maybe inspire conversations about what are they doing for the recovery. And it's okay to ask them, what have you done for your sobriety today? What have you done for your wellbriety today? And that's an okay question to ask, and it might get them thinking that they need to be purposeful. The other piece I want to encourage us all is to maintain an attitude of gratitude. Be thankful that we have an opportunity to go through this experience together. Everyone is experiencing anxiety. Everyone is experiencing some isolation, and have that conversation about what that feels like. And when we know that we aren't alone, we are inspired to get through this together. Make a list of gratitude. Make a list of what we're grateful for. Those type of simple gestures about Thankfully that we have different aspects of our well-being about us today. We're healthy today. We can have a gratitude list that can be immeasurable and we can refer to often. Be aware of what our triggers are. Know that sometimes when if we're isolating too much, that can be a trigger for us. But what can we do to get out of that, that place of loneliness can be very, very helpful. And then also just know that during this time when we're practicing safety, that it's meaningful time, that when we are doing the next right thing, that we're that much closer to being able to be together again. So I encourage folks to visit our website at www.cocaberks.org to find out about the myriad of wealth of information that is on our website as it relates to how to extend and take advantage of those virtual meetings and those chat rooms and those teleconferences that are existing. They are happening around the clock every day until we can go through this storm together. But also, please feel free to give our office a call. I will leave my number, my personal extension, if you'd like to reach out to me. That's 610-376-8669. My extension is 123. Let me know how you're doing. If you want to have me give you a call back and you just kind of want to talk about recovery, be more than glad to do that with you. The Council on Chemical Abuse is here to support you, to nurture you, to help you on your way to recovery. We want to say, be thankful, be well, and we will get through this together. So Stan, I'm going to turn it back over to you and just thank you for the opportunity to speak to everyone today.
Thank you, Yvonne. And thank everyone for coming in and participating in this. Again, thank you to District Attorney John Adams, Dr. William Santoro, and Yvonne Stroman for participating. Again, if you have any questions, this wasn't a live event, but if you have any questions, please put it in our comments section. Again, SOS Berks website is sosberks.org or sosberks.com, or you can go to the COCA Berks website at cocaberks.org. I want to give a special thank you to my co-chair, Commissioner Kevin Barnhardt, and thank him for all the support. I want to thank all the commissioners for all their support regarding substance use issues. I say this often, that we were able to address the overdose issue as well as we did, and it could have been a lot worse in Berks County if we didn't have the infrastructure that was in place. And that infrastructure was a commitment by the County of Berks and our commissioners, not just this Board of Commissioners, but previous boards of commissioners who have saw the need that substance use issues go beyond just the person with the problem. It affects every part of our community. So thank you, Berks County Commissioners. Thank you, Commissioner Barnhardt, for your co-chairmanship on this. I also want to thank Commissioner Barnhardt and the Board of Commissioners for all the work they're doing on the COVID situation right now. This is not an easy situation. There is no playbook for this. There's no pat answers on what you're supposed to do next around this. And there's a lot of difficult things that they have to deal with. And they're keeping their eye on the ball, obviously. He's taken his time, Commissioner Barnhardt, out of his busy schedule to be here to talk to the residents of Berks County. So I'm actually going to hand this over to Commissioner Barnhardt to give the final kind of say on this, and stay safe and be well, everybody.
Thank you, Stan. I just want to say from the professionals, thank you. I now have an attitude of gratitude for what everyone has done on this program today. Stan covering the overview of Narcan, a warm handoff from Blue Cares, to John telling us the dangers of illicit drugs on the street and the supply and demand. Still a battle day in, day out. Dr. Santoro really going through the phases of treatment, really eye-opening and a real experience for me, talking about the challenges with telehealth. It's not a perfect scenario. Yvonne, isolation is also a disease. I mean, these things are really, process addiction. Get your exercise, get your rest, have a sense of purpose, and it's all about family. So these things now, during this crisis, really come to bear when we really need each other. And we're all in this together, and we're all going to come out of this safe and better people for it. So thank you, and God bless everyone. And until we see you next time, be safe.